What if your face isn't just a reflection of age, but a map of your thyroid's health? We often look in the mirror and see fatigue, swelling, or wrinkles, but we don't realize it might be a signal from inside. The thyroid is the body's conductor. It controls weight, energy, sleep, mood, and even your face. Thyroid issues often go unnoticed for years, but the face doesn't lie. It shows early, visible clues. Too many people blame it on age, tiredness, or just genetics. And that's a mistake. In this video, you'll learn 10 facial signs that may point to thyroid dysfunction. No scare tactics, no myths, just accurate signs proven through experience. Some of them you've seen, but never linked to hormones. This video isn't a diagnosis, but a chance to spot the signs early. And if you're over 60 and haven't checked your thyroid in a while, watch closely. Sometimes one look in the mirror is enough to know it's time to act. Your face isn't your enemy, it's your helper. You just have to learn to read it. But before we begin, subscribe to the channel. That way, you won't miss other helpful health and hormone content. And drop a comment. Have you noticed any unexplained changes in your face? Now let's look at 10 signals your face may be showing if your thyroid is out of balance. The first warning sign is a doughy or puffy face. It's not just swelling. The skin loses its firmness, becomes spongy, and facial features start to look blurred and indistinct. People often describe it as a morning face, but the puffiness lingers throughout the day. This may be a subtle sign of reduced thyroid function. Why does this happen? The thyroid regulates proteins and fluid balance. When hormone levels are low, fluid tends to accumulate, especially in the soft tissues of the face. Look closely at your eyes, cheeks, and jawline. If everything seems to sink downward and your features look heavier, it could be a red flag, especially if your face used to appear more defined. Doctors sometimes refer to this condition as myxedema. It's not just about appearance, it's about biochemistry. And if you catch it early, you can fix it before it causes serious damage. The key is not to dismiss changes as weather or poor sleep. If your face has changed, your thyroid might be involved. The second noticeable sign is drooping outer edges of the eyebrows. This sign often goes unnoticed at first, but it can be one of the earliest indicators. Normally, the brow line slightly lifts or stays level. With hypothyroidism, the outer third of the eyebrow seems to vanish or slope downward. This happens due to disrupted metabolism in the skin and hair follicles. The thyroid slows down growth, causing hair in this area to thin and fall out. It's especially visible in women over 50. Makeup doesn't sit right, brows become uneven, and the outer edges need more and more filling. Sometimes it's combined with dry, itchy skin near the temples. These are combo symptoms of low thyroid hormone levels. Don't wait until eyelashes start falling out too. At this stage, it's already time to check TSH and T4 levels. The third signal is persistent paleness or a sallow complexion. Even with good sleep and fresh air, your facial tone doesn't bounce back. The thyroid controls blood flow and oxygen delivery to tissues. When it underperforms, the skin gets less nourishment, and it shows. Cheeks lose their color, lips look faded, and the face appears tired even when you've rested well. In the mirror, it may look like your skin is dusty or dull. No cream or foundation seems to fix it. It may also come with dry skin, especially around the nose and forehead, flakiness, and a feeling of tightness. This complexion change isn't just about looks. It's a marker metabolism is off, and your thyroid could be the missing piece. The fourth sign, puffy and undefined lips. Lips lose their shape and appear swollen, but not in a plump or healthy way. This may stem from fluid retention and reduced muscle tone, both of which are influenced by thyroid function. The lower lip seems sluggish, less firm, and the corners of the mouth may droop slightly. It's most noticeable in the morning. Lips look blurred, contours faded, and makeup doesn't apply well. Sometimes there's tingling or itching, especially in cold weather, another sign of metabolic disruption. If your lips feel oddly sluggish, it's time to check your hormones. This isn't just about looks, it's a sign of deeper imbalance. The fifth signal, under eye bags that don't go away even after sleep, especially around the upper cheekbones and inner corners of the eyes. This may point to fluid retention and sluggish lymphatic drainage, both processes regulated by the thyroid. Visually, the eyes look smaller, eyelids heavier, and the face seems tired in the morning. Sometimes it feels like the eyes are puffy or swollen. If you also experience facial stiffness in the morning and weak facial expressions, that's a combined sign of reduced thyroid function. A more serious sign is when under-eye puffiness is combined with swelling in the shins or fingers. This points to a systemic issue. The thyroid is slowing down metabolism, causing fluid to linger, and the face shows it first. The sixth signal is persistent dryness of the facial skin, especially around the cheeks, sides of the nose, and forehead. Even with creams and oils, your skin seems to ignore the care. The dryness keeps coming back. This is because low thyroid function reduces sebum production and disrupts the skin's ability to retain moisture. The skin becomes thinner, flushes easily, and may start flaking, especially during colder months. Sometimes even washing your face causes a tight feeling, making you want to immediately apply something oily. This kind of lifeless skin isn't a cosmetic issue. It's an internal message your body is lacking hormonal support. The seventh sign, facial asymmetry that develops with age. One eye seems higher, an eyebrow lower, a corner of the mouth slightly shifted. This isn't just aging or natural structure. Often, it's linked to muscle weakness or nerve signaling, and that means hormonal imbalance. The thyroid directly affects the state of small facial muscles. When it weakens, facial symmetry may start to shift. It's especially noticeable at rest. When you're not speaking or smiling, the face appears slightly tilted to one side. Over time, it can worsen, especially if you're physically inactive or your sleep is disrupted. Asymmetry isn't always cosmetic. Sometimes it's a subtle signal. Your thyroid has stopped keeping balance within. The eighth signal, a dull, tight gaze, as if the eyes have lost their depth and liveliness. People often say, "You look tired," even when you've had sleep. The reason isn't fatigue, it's hormonal slowing. With low thyroid hormones, the facial and eye muscles move less. The gaze becomes frozen. Sometimes it feels like you're staring into one spot without realizing it. It's not about focus, it's about inner tone. This look is common in people with slow metabolism, sluggish speech, heavy body, and muted emotions. The eyes are the mirror of the soul and of hormonal health, and the thyroid is often the first to distort that reflection. The ninth sign, facial puffiness, especially under the eyes, in the eyelids, around the nose, and even the cheeks. It's not just too much salt or poor sleep. It's sluggish lymph flow and fluid retention due to low thyroid function. The thyroid regulates metabolism and fluid elimination. When it slows down, the face bloats and loses its sharpness. This is especially obvious in the morning. A creased pillow imprint, puffy eyelids, and a heavy face upon waking. Some people worry, is it my kidneys? But in reality, it may be your thyroid struggling to keep up. This puffiness isn't just cosmetic, it's your body's way of saying, "I'm stuck. Help me start moving again." The 10th signal, sudden changes in facial expression flexibility. Your face feels numb or unexpressive, like emotions don't fully reach it anymore. You try to smile, but the smile feels weaker. Your reactions are slower. You notice it most in photos or videos. Your face doesn't respond like it used to. This is a sign the thyroid is affecting your neuromuscular coordination. Hormones are responsible not only for mood, but for how that mood appears on your face. The connection between emotions and facial movement starts to fade. People might say, "You seem distant," or "Are you upset?" even if you're not. It's not about being sad. It's about the body losing subtle responsiveness. A hormonal slowdown can mute even joy or curiosity on your face. If you feel that your emotions are intact, but your face doesn't show them anymore, don't ignore it. Your thyroid might be the missing link. This facial disconnect is your body saying, "I'm here," but the signals are weak. And the good news, they can return with balance and support. We've shared 10 signs your face may show when your thyroid is out of sync. These signals may seem like small things, but health is built from them, and the body speaks if we learn to listen. Subscribe if you want more honest, in-depth insights about the body after 60. No fear, no empty promises. Leave a like if this video helped you take a more attentive look at yourself. And in the comments, tell us which signs did you recognize in yourself, and what do you want to explore in the next video.